Hello everyone, this is our evidence-based practice presentation.
Presented by Jenna Payon, Lexi Fuqua, Megan Goff, Nicole Marchison, and Chelsea Suttle.
We would like to begin by providing background information.
To introduce our topic, we wanted to research if there was a correlation between the amount of staff and the patient satisfaction ratings along with patient outcomes. Patients should not have to worry about how long it will take to have their call light answered or if they are receiving the best care possible. Their top priority is to get healthy enough to go home and go back to their normal routine. We should strive to make work conditions more desirable for nurses. If nurses can look forward to coming to work every day because the work conditions are positive, then the nurses will be increasingly motivated to do their job to the best of their ability. Better nurse-to-patient ratios are extremely important because the workload placed on each nurse will be less demanding, allowing for better quality of care and less room for errors. Safer and better patient outcomes include less risk for medication errors, more effective pain management, less falls, less hospital-acquired infections, less pressure ulcers, and a decreased mortality rate. Better nursing outcomes include avoiding nurse burnout, increased motivation, more thorough assessments, and better time management. Nursing shortages and financial problems are factors that have led to hiring underqualified staff, which can lead to the higher probability of negative patient outcomes, including mortality and increased risk for infection, along with decreased patient satisfaction. Some states have laws that mandate the amount of patients a nurse can have on their assignment. This should become a law in more states to decrease the amount of adverse patient effects and the nurse turnover rate. This is an example of the proposed federal registered nurse ratios. This would be in an ideal, perfect nursing world. They will be able to use this research to pilot their own studies to adjust the ratio accordingly to see what would work best for their specialty. Why does the nurse-patient ratio need to be changed? This problem affects all nurses. By increasing the number of nurse staffing, it will lead to safer and better patient outcomes. Current interventions include assignments are currently based on staffing, which can be negative for many reasons. When a nurse calls off for their shift, the other nurses are responsible for the other patients. This places excess workload on the nurses, leading to an increased risk for error. On the other hand, when there are not enough patients on the floor, the facility is forced to downstaff nurses, which creates frustration when nurses rely on their paycheck, which could lead to a higher nurse turnover rate. Tuition reimbursement is an incentive for nurses to work in certain facilities. Proposed changes would include the patient acuity tool. It would be used by making nursing assignments more equal and fair for the nursing staff. You would look at how high the patient's level of care is by seeing how many medications they receive, if they have any IVs, if they require psychosocial interventions, and seeing if they have any procedures that need to be done. The proposed changes will lead to maximum nurse-patient ratios. Measurement indicators include surveys that would be given to patients after their hospital stay about patient satisfaction and any recommended changes that could be made. The limitation of the survey could be a low response rate. We can also analyze the readmission rate along with mortality rates. Also, looking at statistics of falls, medication errors, and skin breakdown are good indicators. Lastly, the nurse turnover rate in facilities will indicate if the changes are creating positive nursing outcomes.
After researching several articles and comparing, we were able to find a qualitative and two quantitative articles related to nurse-patient ratios in relation to patient outcomes. These studies provided us our foundation for creating our own study. How nurses and their work environment affect patient experiences of the quality of care, a qualitative study. The article talked about different areas in the work environment and how patient care is interpreted by nurses. The researcher determined that what patients express is their understanding and reflect the patient's actual experience. This experience can lead to modifying nursing and adjusting to environmental needs. Patients evaluate their care, so hospitals can reflect on the patient's opinion of their quality of care. The studies have found that there were several basics for quality of care. These basics for care are used when developing patient questionnaires. If the nurse finds the environment to be healthy, then the patient will receive correct care. If the nurses are unhappy in their current job situation, the patient's quality of care will be unsatisfactory. Other findings are that when nurses are forced to use expertise, skills, and clinical knowledge, the patient care is improved. The article purpose was to understand from the perspective of nurses how the nursing work environment is related to positive patient experiences. The study results stated that there are little nurses can do to improve patient outcomes. Because of facilities cutting costs and having to reach certain goals set by the facility, specific findings on the staffing are as such. Nurses need to become more efficient, therefore individuals with less qualifications are being assigned more tasks. There is no exact ratio for nurse to patient to have positive patient outcomes. The ratio is based on the patient's thoughts of how their needs were met. One nurse said, "I work alone in a group because I'm responsible for other patients. I provide patient care too hastily. My patients obviously feel that." Researchers know that nursing care and the environment are linked from past research. However, the specific variables of how has not been found. According to the limitations section of the study, the author noted that the patient's views were not discussed in the study. Therefore, further research should be done to understand the patient's thoughts of their care. The article was helpful to understand how the nurse influenced the patient's quality of care and was also informative on the fact that nursing staff ratios cannot be standard numbers. They are based on so much more, such as expertise levels, knowledge levels, and individual workload.
Quantitative study number 1. Nurse staffing, medical staffing, and mortality into intensive care, an observational study. This is a quantitative study done to determine whether or not the size of the nursing staff had an impact on the survival rate of patients who were critically ill, both in the ICU and in the hospital. The independent variable is the size of the nursing staff. The dependent variable is the outcome of the patients in the ICU and hospital. The purpose of the study is to investigate whether the size of the workforce, including nurses, doctors, and support staff, has an impact on the survival chances of critically ill patients, both in the ICU and in the hospital. The sample size of this study consisted of 65 ICUs and 36,168 patients. The sampling method of the study would be convenience sampling because the researchers had to use the patients who were readily available in the ICU and were not able to proactively seek out specific subjects. The design of the study was a cross-sectional, retrospective, risk-adjusted observational study. In a cross-sectional study, data is collected on the whole study population at a single point in time to examine the relationship between nurse-to-patient ratio and patient outcomes. The information about patients, including the outcome of care, whether the patient lived or died, came from the Intensive Care National Audit and Research Center. An audit commission survey of ICUs conducted in 1998 gave information about staffing levels. Data was collected for 6 months before and after March 1998. The matched dataset contained information only on ICUs in England. Multi-level logistic regression was the statistical method used to perform all of the analyses on this study. This study had found that a higher number of staff on the unit improved the patient's survival chances. The most significant findings are that controlling for patient characteristics and the workload of the unit, higher numbers of nurses per bed on the unit's establishment, and higher number of consultants per bed were both associated with higher survival rates. This study concluded that medical and nursing staff availability was in fact related to the survival rate of the critically ill.
Quantitative Study 2. Does better nurse staffing improve detection of depression and anxiety as secondary conditions in hospitalized patients with pneumonia? The purpose of this study was to explore the correlation between patient-nurse ratios and the diagnosis of anxiety and mood disorders in patients with pneumonia, a diagnosis considered to be secondary to more pressing diagnoses like hospital-acquired infections or pressure ulcers. The results of this study revealed patients admitted to hospitals that have fewer than 3 patients per nurse are more likely to receive secondary anxiety and mood disorder diagnosis. Nurses with smaller patient loads were able to recognize secondary conditions of anxiety and depression in patients with pneumonia because they were able to have more one-on-one time with their patients. Nurses were able to provide more in-depth care because they were not only focusing on more life-threatening conditions/symptoms. This study supports the other research that documents a direct correlation between patient outcomes and nurse-to-patient ratio. The research presented here supports that nurses with smaller patient loads have better patient outcomes.
We will now describe our study of how to ensure proper nurse-patient ratios are maintained as evidenced by patient outcomes.
The PCOT question is, what is the effect on patient outcomes when registered nurses have increased staffing on medical surgical units? The proposed changes that we would like to see is an increased number of nurses on the unit. By increasing the number of nurses on the unit, we will see better patient outcomes. Our resources would include implementing a new patient satisfaction survey process, where patients will receive a survey card with discharge paperwork. The survey card will be filled out anonymously before the patient leaves the hospital and submitted into a labeled confidential box in the unit. This will overall increase patients' response rate. A designated floor nurse will be responsible for hiring, scheduling based off census for the day, and looking at patient satisfaction surveys. This new position would involve reviewing surveys and holding huddles to communicate with staff on how the unit is doing in terms of patient outcomes. We would pilot this new position for 6 months and obtain patient outcome surveys for a year. Surveys will be collected 6 months prior to the new implemented position. The surveys will be compared from before the position was implemented to after the position was implemented in order for us to see if patient outcomes were better.
If adding a staff nurse position benefits the patient outcomes for the floor, then the staff position will become permanent. All management will communicate through meetings, memos, and emails about the added position and discuss their roles and responsibilities. The new position member should attend staff meetings, huddles, and administrative meetings. The floor should continue monitoring patient outcomes through patient surveys. The facility feasibility will need to be evaluated if there is money in the budget for this new position to be maintained.
In conclusion, one can see that the question of what is the effect on patient outcomes when registered nurses have increased staffing on medical surgical units is one that has already been researched because of the importance in the clinical setting. This is a rather broad area of research and has been addressed from different angles. After completion of this research study, the data will have to be reevaluated to implement policy change. So I believe the best course of action is to compile all the data and compare research until there can be significant change or evidence to support keeping procedures as they are now. Just as in this small sample of studies, you can see that the data is not not conclusive, and there is an obvious gap in knowledge. Through different methods, theories, settings, populations, and analysis, a more comprehensive view of the research question can be achieved for the better care of patients.
Thank you for watching our presentation.